Assalamu alaikum. Welcome to this episode of Second Home. Today we continue to cover the medical camp organized by the Managers Association in collaboration with the Indian Doctors Forum and the Royal City Clinic. This camp was organized for the Bangladeshi community here in Kuwait. They have a huge community here of around 350,000 people. I'm sure this camp has benefited their community, and a lot of people have come up selflessly to service these people. It's a great, noble gesture on their part, and we are here to cover it all for you so you can watch it all from the comfort of your homes. So let's go and have some more conversations. We're in conversation with the Managing Director of Royal City Clinic, Mr. Muhammad Arif Sheikh. Welcome to our show.
Thank you very much, Amna. Thank you.
Tell us about today and your involvement. This is a huge medical camp here arranged for the Bangladeshi community. How are you involved?
We were invited by the community to participate in the event, and we've thought that is a good opportunity to present ourselves and our services. So we are in with our doctors, Dr. Najma, and we are in with our equipment as well, the ECG machines and the blood test and all the machines. We're not only here by ourselves, we are also here with our families. And my son is here with me.
I did get a chance to meet him briefly.
Well, he's here. He's running around with all the stuff. And secondly, I mean, wherever there is some test required or medicines required, we have bought a stock with us for medicines, commonly used medicines, and the medicines which are not available, the patients can just walk to the clinic and take the medicines and the blood test and X-rays from there.
That would be really convenient for the people who are coming here, because it's one thing to tell them their diagnosis and send them away and leave them wondering how are they going to resolve this, and being able to give them a 360-degree solution, like here's the problem and here's your solution.
I was just informed that one of the patients was diagnosed of cancer and she was not aware of it. So I think the whole event and saving one person, I think it's worth it. It's really worth it, and I think everyone's efforts who've put in for this is rewarded actually.
But to diagnose something like cancer, I'm sure the equipments you've got in for this, that must have been a lot of work and dedication from your team too.
It's not only the equipment, those doctors that are here, not only from my clinic, but in fact the doctors from the major hospitals of Kuwait, and not only Bangladeshi community, but every doctor who's known about this has come and volunteered, and they're so experienced. Sometimes they really don't need equipment. They have this experience that can tell that. So that's something that I feel that we've really got out of this event.
Absolutely. So you own this clinic. Tell me, what inspired you to open up a clinic? You could have done so much. I believe you did your business studies in Pakistan.
We wanted to give back something to the community. Yes, we are not from this country, but I've been brought up here, and we are part of City Clinic Group. We started in 2006 in Murgaon with a small clinic, and then we opened one in Fahil. and then Jilib, the Royal City Clinic in Jilib is the third, and we couple of days ago inaugurated one in Mahbula as well.
Mabruk.
Allah Barik Feek.
But this is what I love about people who've lived in Kuwait, even as children and as students. They would go back to their country, they would study, and then they would come back to Kuwait because that's how close we feel to Kuwait. I'm similar. I studied here and wanted to come back to Kuwait and be here.
Same here. I did my school from here, and then during the invasion was forced to go back, and then I complete my education over there, and then we coming back and serving the country, and also been part of Kuwait Finance House for the past 24 years, so that's a long period too.
How do you manage? I believe you fly in and out a lot. How do you, give equal time to your family? There's a lot going on here too.
This is tough. This time I've got my family with me for Ramadan, but I'm 15 days here and 15 days in Pakistan. The other director who comes and covers for the 15 days while I'm there, because I do have other things, like I got an orphanage and a school in Pakistan as well.
Mashallah, because it's like layers and layers of appeals that are coming out, and mashallah, that's great work. May Allah bless you more for all these things that you're doing. Jazakallah khair. And thank you so much for talking to us. Is there any message you'd like to give to your viewers today?
I think we should have events not only for the Bengali community, we should have for the Indian community and for the Pakistani community as well. And this is something which is really good, and finding a patient like this who doesn't know that he has such a big sickness, that I think is worth the whole effort.
Absolutely. Thank you so much for talking to us. Allow me to introduce to you Dr. Arijit, a doctor from the Indian Doctors Forum who's helping out here today. Good morning.
Hello and good morning. I'm Dr. Arijit Chattopadhyay. I'm working as a consultant endocrinologist in Al Sabah Hospital, Ministry of Health. And I take the privilege that organizing the health awareness camp in association with Managers Association Kuwait, in collaboration with an active support from our paternity Indian Doctors Forum Kuwait.
So you, as part of Indian Doctors Forum, was responsible for getting all these doctors together for today's campaign.
Yeah, it's absolutely true. For the last 2 months, I have been coordinating on behalf of Indian Doctors Forum as a prominent member, executive committee member of IDF, and I could gather, doctors from different specialties. More than 20 doctors have participated in today's camp, and in a various specialties and subspecialties doctors, they have attended the camp. It's a great day for me.
I'm sure it is a success, and it's nice to see when you worked so hard for the day to come, as successful as this. I believe a lot of people have gained from today.
Absolutely. I was sitting in the diabetes and hypertension clinic with my senior colleague, Dr. Alexander, and we have diagnosed a pretty large number of diabetic patients, and we have given instructions about their modification of treatments and the further follow-up of these patients. I'm pretty sure that many of these patients would not get this kind of privilege and access to a professional care, a systematic management and care, and I believe that this will definitely help in the long-term management and control of their disease.
I've heard a lot about diabetes today. Why is it that it's so prevalent? I understand diabetes comes from eating a lot of sweets. Do Bangladeshi people eat a lot of sweets? Do they like sweets?
I must tell you that we all Bengalis, whether from Bangladesh or from India, we have a sweet tooth. Bengali sweets are famous all over India and all over world. So we love sweets, like in various parts of India, different specialities of sweets are prominent. But we need to understand that genetically, both Indians and Bangladeshi people from Southeast Asia, we have a higher risk of developing diabetes and pre-diabetes. We must be careful that it's not only the diets, but also genetic risk, which makes us more vulnerable to diabetes and its complication.
So you're not just giving them medication, but you're also making them aware about good food and its nutritional values and not taking in too much sugar.
That's right. And in today's camp, besides the direct patient care, we have also organized the lectures, health awareness lecture, where the doctors, like my senior colleague, Dr. Deb and Dr. Chinmay, they have deliberated on the highlights of diabetes, hypertension, and heart disease for the masses, how to take care of them, and awareness of these particular diseases.
And we are probably only just halfway through the day, but could you give me a count of the number of people you've already seen?
I'm not sure about the numbers because I was in one of the stations, and it was such a vital. We have actually, myself has seen more than 40 patients. Along with another colleague, we have covered more than 80 patients in one room. So I think it's a pretty large number of people who have gathered today and took the benefit and advantage of our health camp.
Thank you so much for organizing this and what you've done. May Allah bless you in tenfolds.
Thank you. It was my pleasure talking to you.
We are now talking to Dr. Alexander. He's part of the IDF as well, the Indian Doctors Forum, and is here to give his expertise to the community. Thank you so much for talking to us today.
Thank you, Madam. I am Dr. Alexander. I am a consultant in internal medicine, Sabha Hospital. Well, it gives me an extreme pleasure to be a part of this community activity, which gives an excellent satisfaction by myself. That I could see a good number of patients, and it seems that I could diagnose a good number of new hypertensive cases and diabetic patients. To me, it seems that such type of activities, especially with an organization like that of you yourself, I understand this is from in cooperation with IDF and with the Managers Association, I think so. And such activities should be continued in future also to help this type of underprivileged patients to a great extent.
I believe doctors such as you in taking your time out to do this noble deed here is commendable, and I'm sure the community that is taking benefit from this appreciates what you do, and I love how you're saying that we should keep doing it in future. That shows your willingness and eagerness to help, which is great.
As commitment to the community, we, the doctors, we are not only confined to ourselves. Our commitment to the community is very high. And to a particular community like this, which gives us more time and more comfort to discuss and sort out their problems. The follow-up of this patient should be done in a better way. This is what is my suggestion.
Yes, I was just going to come to that because this is great that you are now diagnosing it and you are also giving immediate medicinal needs. But diabetes and heart issues are not really one-time deal where you can, fix them completely in a day. So follow-up is important.
Follow-up is very important on most of these cases which I have seen or which we have seen. We have totally seen a good number of patients, exact number I am not sure, but a follow-up of this patient is very important and it should be done, and we have given them excellent educational words, excellent education to them to how to follow up with their cases.
Awareness. I believe there's a lecture by a doctor who's talking about how to raise awareness to just stay healthy. Instead of taking in a lot of medicines, if you can stay healthy from the beginning.
That's correct. That's correct. You are absolutely right. We have given them enough tips how to stay healthy, especially by modifying their lifestyles. The lifestyle modification is the most important in all these lifestyle diseases.
Doctor, but in your viewpoint as a doc, I would like you to give our audience a tip before you leave about viewers in Kuwait. What do you think they should do to lead a healthier life?
The most important thing in a place like in Kuwait, people are hesitant to do activities. They are not concerned with their lifestyle activities. They should do activities, exercise, and they should modify their lifestyle, because most of the diseases here are lifestyle diseases. That is my suggestion.
So all you children out there, leave your iPad, get out, get some physical exercise. You have 3-month-long vacations. You need to make friends and do some physical exercise, right, Doc?
That's right. That's right. Perfectly right.
Okay.
I fully agree with it.
So you've heard from the doctor. Stay healthy. I would now like to introduce to you Dr. Tabassum, who's come from Bangladesh to Kuwait visiting for this event. Thank you so much for talking to us.
Hello, welcome. Nice to meet you.
Same here, Doctor. Tell us about your observations today here. You've visited Kuwait, this is the second time.
Yeah, this is the second time I visit here, as my husband is working here in Bangladesh Embassy as a defense attaché. He told me about this even a week before. So I'm really impressed about this occasion, and I love to join this occasion.
So far in your observations, what do you think would you highlight about the general health of Bangladeshi community here in Kuwait?
Bangladeshi community, you know, there is a lot of Bangladeshi communities here, and they are working here with their families, and I think they should be more aware about their health. So this is a very good opportunity. They have to meet, they have to come here, and you know that we have some Bangladeshi doctors here in this occasion, and with some doctors from India. So I think this is a good opportunity for them, that at least they should know about their problem and where they have to go. So this is good.
Do you have any tip for our viewers here?
Okay. As I'm doing my post-graduation in gynecology, I want to say all the women that at least after 35 years, they should have a yearly checkup for cervical cancer and breast cancer screening. As you know, that these are two most leading cause of death in women in all over the world, and most likely in our countries. I don't know about sure this Kuwait, but in our countries and Indian subcontinents, it's the first and second leading cause of death. So they have to, I like to say that they should do a screening test at least a year about the cervical cancer and breast cancer. And you know that prevention is better than cure.
Absolutely, well said. Although I do have a question, because you know we always talk about getting ourselves screened and tested, but a lot of women are shocked because sometimes these tests can be really painful, and they don't really know that it's going to be painful. Do these tests have to be painful, or is it only for people who have a problem that it's painful?
It's not like that painful, but I think they don't know the exact way of examination, most likely general people. But if we aware them, I think they should be more comfortable with this test, right?
So it's not necessarily a painful process because most women would, shy away from it if they find out that it's painful.
Yes, most people feel shy about the examination. Yeah, so I think they should be on focus that they should do it. Yeah.
Yes, so don't feel shy. This is your health. Take health in your hands and be healthy. Message from Dr. Tabassum. Let's take her seriously. Thank you so much for talking to us, Doctor. Thank you. We are now in conversation with Dr. Najma Taludkar, who works as a general physician at the Royal City Clinic. Thank you so much for talking to us.
Hello, nice to meet you. I'm Dr. Najma Taludkar, general physician at Royal City Clinics.
Tell us about your observations today. You're here to serve the Bangladeshi community. What do you think about all the people who are coming in? Do they have some very common ailments?
Yeah. First times I feel very proud to be here to serve our community. Most of the patients are here underprivileged people, no? So today I have seen most of the patients, they are suffering from the diabetes, hypertension, and one more common thing is renal calculi, that means kidney stone, no? It's very common in Kuwait due to the dry weather.
What should people do to avoid that? Kidney stone is, I believe, a major problem here. And you mentioned because of the dry weather, people lose out water a lot more.
So they have to drink plenty of water, at least 10 to 12 glass per day, and take just vitamin C-rich fruits like lemon juice, orange juice. That's enough.
So is it okay to take vitamin C? I've heard that taking excess of vitamin C could also lead to kidney stone.
But they can take, no, just fruit juice, they can take 1 or 2 glass per day. Vitamin C, just orange juice, lemon juice, 1 or 2 glass per day, and plenty of water, at least 12 to 10 glass of water per day.
Absolutely. Anything else that you've come out? I've seen a lot of diabetes show up today.
Because diabetes is the major common problem in the Kuwait due to the sedentary lifestyle, no? Here lifestyle is not good. More, this lack of physical exercise. So no need to do the vigorous exercise. At least they can walk thrice in a week. Just briskly walking, no? It's enough, 30 to 45 minutes.
Do you get time to exercise?
Yes, I yeah.
What kind of exercises do you do?
It's walking. It's walking.
They say walking is the best exercise.
If not possible, at least thrice in a week. 30 to 45 minutes, enough.
Okay, you heard the doctor. Walking, keep yourself hydrated. Thank you so much for talking to us, and we are going to say bye to go drink some water. This brings us to the end of this week's episode, where we've covered the medical campaign organized by the Managers Association. Next week, we'll bring to you a brand new event. Until then, from the team of Kuwait TV2, stay blessed.